So what exactly is fluoroscopy? In simple terms, it's an imaging technique that allows you to see real-time movement inside the body using x-rays. Unlike a traditional x-ray, which gives you a static, still image, fluoroscopy gives you a live video feed. Imagine watching a barium swallow, seeing the contrast material move through the esophagus in real time, or watching a catheter being guided through a blood vessel during angiography. That's fluoroscopy. Fluoroscopy is essential in many clinical settings, from orthopedic procedures to gastrointestinal exams to cardiac catheterization labs. Fluoro is everywhere. And one of its specialized uses is angiography, where we visualize blood vessels dynamically with contrast injected into the body. There are two big categories in angiography, which is neuroradiology, which focuses on the brain and spinal cord, and vascular radiology, which handles the rest of the body's vessels. And those combined, usually these days, are kind of called interventional radiology, which we won't get too much into, but it's good to know. So, when fluoroscopy was first introduced, the technology was pretty primitive, and honestly, it was pretty dangerous too. Technologists had to sit in a dark room just to let their eyes adjust. It's a process called dark adaptation. And to maintain this adaptation, they wore red goggles, which helped preserve their night vision by filtering out the white light. Even worse, the technologists had to look directly through the fluoroscreen, meaning they were staring straight into the X-ray beam as it exited the patient's body, and this drastically increased their radiation exposure. We didn't have protective shielding or remote monitors yet, so just imagine doing your job with X-rays constantly hitting your eyes and face. That's how early fluoroscopy worked. Alright, so the game changed when the image intensifier was introduced.